Are you a family caregiver? Are you caring for someone with dementia? Do you know that there are questions that you shouldn't ask your loved one? I'm Nurse Karen, and I have been a registered nurse for 30 years and owned a care home for the last 10 years, taking care of more dementia patients than I can even count these days. And it always amazes me how many problems come up because of communication with people that have dementia. And what do I mean? So, I had a patient once that every time her guardian would come to visit, he would leave by saying, "I'll see you later." And after he would leave, um, pretty soon she'd go down to her room and start packing for all of her belongings. And then she would spend the next several hours waiting for him to come back. And I finally realized that it was the phrase, "I'll see you later." And so I talked to that guardian about let's use a different phrase. And that solved the problem. Simply saying goodbye made it so that she didn't feel like she needed to wait for him because he was going to be back. And it's those little words that can make a big difference. And oftentimes people will think that their loved one is sundowning and being agitated when actually it's the words that we're using. So always think about that. What are you saying that is maybe causing them to twist it in their mind and think about it differently than you and I would normally think about something? Because all the rest of us know that "see you later" means that we'll just see you the next time that happens, not literally in a little while. So, what other words or phrases get people into trouble? The thing that I hear the most that people will say is, "What'd you eat for breakfast?" And, someone who has dementia can't remember usually what they ate for breakfast. Or people will even say, "What'd you eat for dinner yesterday?" And I'm always like, don't ask that question. It causes them to feel frustrated. Nobody wants to confront the fact that they can't remember, and for some people, they get quite agitated when they are confronted with the fact that they can't remember things. So instead of walking in and using that as using, "Hey, what did you do yesterday?" or "What did you have for breakfast?" or "What did you do earlier today?" It's better to talk to people with dementia about what's been going on in your life or what they are currently doing, or talk about something in the distant past. Because usually they remember those things, the stories from when they were young or when they were having kids. Those things are much easier for them to remember than what they ate for breakfast or dinner yesterday. And so those are good things. And I always encourage the people that come to visit that they should introduce who they are, even though they might have known this person their whole life and or even be the child of a dementia patient. Make sure you start out by saying, "Hey mom, this is Karen, your oldest daughter. It's so good to see you today." And in fact, when people come to visit people that I'm caring for that have dementia, I will introduce them to them. "Hey, look, this is your daughter," and help them to clue into who is there to visit. And the next thing to realize is that if your loved one isn't understanding who you are or who people are around them, just go with it. It doesn't really matter in the scope of things. You can still have an enjoyable visit. One of the people that I care for, she was going on and on talking to her daughter, all about asking the daughter what her mom enjoyed to do. And, I thought, wow, that must be really hard for that daughter to have to talk about her mother without mom realizing that it's her that they are talking about. So just go with where your loved one is and stop trying to fight it. You know, when I was in nursing school back in the early 90s, the thought back then was that we should reorient people. And I am so glad that that practice went away because reorienting doesn't make anyone happier. It frustrates the person with the dementia and it frustrates you as the caregiver. Instead, focus on having good times together. Don't worry about what they ate earlier or what activity they did earlier. Worry about what they want to do right now, what would feel good now. And that will help you to have great visits. And if you are living with someone with dementia, uh, helping other people understand what kinds of questions to ask and to say when they come to visit will help you to have a better day. Just like that person that used to come and say, "See you later." That caused me all sorts of headaches until we realized that we needed to make sure we used the proper words. If you have more questions about being the best caregiver ever, then make sure you check out my other videos and I will help you find the best path for both you and your loved one because both of you need to be happy in order to have a successful relationship as a caregiver.